Recording. We'll start. Yeah, go ahead with both of them.
Well, hi, my name is Chris Edison, and we're just going to start off with the fun story because you guys are here for the lab for ICU. So the ER, the patient was unconscious, had a note, it was covered in vomit, and empty bottle pills of SSRIs of Zoloft and ibuprofen was found, bleeding at both arms from cuts. Parents just took the child to the ER and they are in distress. So eventually we get to learn more about the patient. Male, 20 years old. Patient comes in unconscious with vomit dripping out of their mouth with cyanosis. They present with multiple cuts on both arms. Their initial vital signs were like blood pressure, 86/52. So that's pulse 130, temperature 99.2, O2 is 79%, and respiration rate is 6. So with wheezing, grunting, adventitious sounds like we just listened to the lungs. You then receive this patient in the ICU. You learn the vomit was clean, bleeding has been controlled by the ER, vitals have improved, blood pressure is 98/62, pulse is 97, temperature is 98.4, O2 is 91%, respiration rate is 12. Breathing is equal and bilateral, it's a little shallow, but they're on 2 liters per minute of oxygen. And the ER has given the patient blood products to help get that blood pressure up and do the bleeding that was from the previous slide. And they currently just have them on NS. Blood products have been given, and it's just the left antecubital vein. Labs have been taken and charted. Aspiration of vomit has been assumed. That's what they've charted. And so he just shows up in your ICU, and that's kind of what you know. We can go back to the slide if you want to, but like, how would you like to start your assessment? And like, there's some like limited knowledge, of course, but you don't know a lot about the patient. Like, did they say like he was learn oriented or things like that? So how would you like really want to start this assessment? Just knowing that you're in the ICU, that's an intense critical patient, and it's okay. You don't like have like immediate answers, but we can always go over some, because sometimes where I just like to begin is like a head to toe assessment. Just like, okay, can they talk to me? Do they know who they are? Like, do they know their name? Can they learn like my name? Can they recognize me as the nurse? Do they know that I'm here? Like basically time, place, situation, and person. Just the 4 big things. Because
Did you say he was intubated or no?
No.
No? Okay.
No.
Yeah.
I think they like basically I just had it like they what's the younger,
Just
but I forgot what
yonkers.
it's called.
Okay.
That you just like suctioned it out.
Okay.
Because I've seen this, well, not like this exact thing, but close to. Basically like in the ICU, like they went to the ER, they're here, and so kind of just how I assess at the beginning, it just again head to toe. But what are some things that you guys would like to look for? It said labs are charted, so you guys can name off labs too. If you guys think anything could be concerning,
I'd be looking at
because
six.
I do have another slide that maybe might be a little more
I
helpful.
want his hemoglobin.
Yeah, we say CDC, we're gonna look at hemoglobin, hematocrit, white
Yeah.
blood cell count. I mean,
Yeah,
probably not, if he's aspirated, it could be aspiration pneumonia eventually, not gonna be
Yeah.
elevated
I
this
want
fast,
I
but-
want a chest X-ray to see.
yeah. No, and those are great, yeah, because like a lot of times it's airway, breathing, and circulation. Like those are just some big things to look for, because like you want to make sure like their mental state's there, because their mental state's not there. Usually something's pretty off, especially if they're like male and like not male, sorry, like they're young. Like if they're older, like you can maybe think of a UTI, but he's younger, and so want to make sure their head's in the right place. Because if confusion noted, we want to make a note of it and try to figure out the cause, because it could be like electrolyte imbalance. And we want to definitely look at like hematocrit, GI, and just lungs as well. So I think all those answers were great.
I think you'd also want to see how the confusion to his extremities is. If he had
Mhm.
cyanosis around his face, maybe it's
Mhm.
gone somewhere else in trouble.
Oh yeah, absolutely.
I think pain, I mean, those GI bleed patients, they do have some pain, I just see.
Yeah.
If he's in pain, what he's been getting for pain. His
Yeah.
respiratory rate went up and his O2 sats are up, but I'd still be curious what he's gotten.
Yeah. And so like you get him, he's conscious, he's alert and oriented, but he's fatigued. He has stomach pain and severe nausea present, just wants to throw up. Halitosis present, bad breath, could be because of the vomit. No exterior bleeding noted anymore. but stools have appeared irregular and dark and tar-like. And so, vital signs, their blood pressure kind of dropped a little bit. Their pulse still like tachycardic, but it went down from 130. It's kind of hard for you to remember because there was a bunch of numbers in there. Temperature is normal. O2 is 91% on 2 liters per minute. But respiratory rate has gone to 16 to 18. So they're breathing slightly more rapidly, but equal bilaterally, slightly shallow. And there's crackling in the upper lobes noted. So these are like the labs. You guys named off quite a few, like hematocrit, 37%, hemoglobin, 11.1, platelets, 155,000, red blood cells, 3.9. And so just looking for bulls, I believe that the hemoglobin and red blood cells are low. The hematocrit, it kind of changes between male and female, but for a male, that's low. Electrolytes, I kind of made these ones be the same, like in normal ranges, because I didn't want to spend too much time and divert you guys because you guys have other stuff to do. But sodium is 140, potassium is 3.5, chloride is 98, calcium is 10, phosphate's 3.1, and magnesium is 2.0. And then I want to like kind of focus on the bottom one, which was bicarbonate, which is 19. Carbonic acid, which is 45, and the pH is 7.3. And so, just from these labs, basically, like things that are mostly low are the hemoglobin, the red blood cells, the hematocrit's low for a male, but not like dangerously low. And then the pH is imbalanced. So essentially, like I don't know if they taught you guys like the fun equation way to like figure out like if it's like metabolic,
Oh, yeah, they know.
respiratory.
They might not be able to recall it this early in the morning, but yeah.
Okay.
There.
Well, no worries. I didn't know. I didn't know like how, because I didn't want to like, because I figured you guys get drilled by Heather, and so I didn't want to like drill anyone. Especially because I don't think I'm not nearly as qualified. But what do you think could be happening potentially just from some things? Because mostly I was just trying to show like the blood pressure has dropped a little bit. And where was it? And the respiratory rate has slightly increased, but like the pulse is also tachycardic. And that was kind of like where I was trying to like lean forward to, I guess. Because you guys did name a few, like aspiration, like that's gonna cause like probably some breathing issues, especially since you got like some crackling. But I don't know if you guys have any ideas, because I have a few, but it's okay. And the pH is imbalanced, so I know he's definitely acidotic, but we could determine like if he's like in metabolic or respiratory acidosis. Mostly determines like which one is out of range and how they're there. So I don't know what range we're using now, but my range is 22 to 28 on the bicarbonate, and the carbonic acid is 35 to 45.
Yeah, correct.
And so basically, so this one's still in range, so this one's out of range, and so this one's lower. So that would mean we're in metabolic acidosis.
Correct, yeah. His kidneys, I'd look back at his kidneys, I'd almost want to get a BUN and creatinine
Yeah.
on that. I mean,
Yeah.
I see the potassium's 3.5, which means they're still functioning a little bit.
Mhm.
There,
Well,
yeah,
and also like if there's like blood present in the urine or like
Yeah.
yeah,
good point.
and but I think like it's uncompensated because
Yes.
if it was compensated, the carbonic acid would be higher to compensate for like the bicarbonate being so low. So right now it's uncompensated. So the body mechanisms haven't exactly like kicked in to like kind of set that imbalance or to correct it. And so this is just a quick overview of some of the problems. The client has 3 problems. Blood pressure has dropped, pulse has increased. So that's like a common sign of like, okay, the heart is compensating for the blood pressure falling. Respiratory rate has increased, but not like beyond its 18. And there's some respiratory distress noted, but mostly just breathing more rapidly and a little shallow. Blood is present in the stools as they've done like a guac test. And the patient is in pH, is in acidosis. So it's probably forgotten already, but like SSRIs and NSAIDs, like when you go to the ER or like BHU, you're going to see overdosing. And not to say those are like, but those are common ones because those are very easy to obtain. And Tylenol also is a very common one. Like I've taken care of patients that just have a Tylenol overdose, and it sucks. Like usually because like they may look like they're fine like after they get out of the ER, but like that nausea and like those like effects like still stay there because they didn't take like just 1 or 2 pills. Like they took a bunch and like it's still like lingering in their system, and they can feel pretty crummy from that. And the NSAIDs overdosed just has an increase of the GI bleed, which is why I put the dark and tarry stools up there. Metabolic acidosis is a very common like effect from drug overdose. And sometimes what happens is like when you're in the metabolic acidosis, then you throw up so much, and then you throw up all like your stomach acid, then you can actually like switch to alkalosis. So it's kind of like a fun, I shouldn't say fun because like this is a person, but like it like you can see a flip and like you gotta like kind of like work your way through like the problem. And aspiration was mentioned. You guys mentioned it, and plenty of complications can occur. Like maybe they can get an infection with aspiration pneumonia. Sometimes people end up being fine if they can like cough it up. That's why like we always focus on like, especially in the ICU, like deep breathing is a great exercise. I believe it's 10 deep breaths every 2 hours, I think, is what they try to do as waking hours. And sometimes more frequently if the patient's like more severe. And but yeah, deep breathing, because that's like one of the best ways. Like if someone's like aspirated, or if someone's like even just really sedentary / not like breathing well, just helps clear out the like lungs and mucus, and they breathe better. And we always try to put them at a better angle for that too, because when you're this way, you're just fighting against gravity to breathe, and there you're working with gravity. All right, but what we don't know is that what's the reason behind the overdose? You learn later that it was a suicide attempt. Well, if he or she, I guess I had it at a male, but it could be either or. If they were same-sex attracted, this could be like their story. And so that's what this presentation is really about, is that when you get to the ER and ICU, like there's always symptoms, but sometimes there's always an underlying story of what could be happening. And in the BHU, we have to look at this very often, because we can treat the symptoms, but if we don't treat like the underlying problems or like issues that the person is facing, then usually what happens is we send them back into the community and they struggle again. And then like it just becomes like a recurring thing. So in the BHU, it's very common to have one patient come in over and over again. It's not just like we treat them and then they're fixed forever. We can send them back into a whole slew of problems that they were already facing. But in Utah, there are 104,000 people that identify open as LGBTQ. That are 13 or older. They didn't. The Movement Advancement Project didn't ask anyone that was under 13. Nationally, 5.6% of Americans identify as same-sex attracted. That was just in the Gallup. Internationally, 3% of people identify lesbian, gay, or homosexual, and 4% identify bisexual. This all combined, that's about 7% of people. This isn't including trans people. This study was conducted in 27 countries, and homosexuality was legal in all of them. So all the countries where homosexuality / just same-sex attracted places, they're just not always legal, and they can't really be open about it. And so they just have to like narrow their search and just try to base their statistics off of that. We're all human, so like individuals that are same-sex attracted are really just the same as heterosexual people. They just have a different preference. While some may openly identify as LGBTQ, others don't always choose to do so, and that could be like maybe the like a thing behind our patient. We don't know. It's always important to like ask and get a good history. Also, just goes along to like mental health, and as nurses, it's always hard to like tackle mental health because it usually requires like a lot of effort. Like usually, not one thing that you do is going to solve a mental health issue. It's usually very deep inside, and then we have to like have a team that's whether psychologists, like doctors, like it's hard to combat, and it's hard to talk about sometimes because sometimes they don't even understand it themselves. And but reasons behind it can vary. There's just negative stigma. Usually it's bullying, rejection, discrimination. You can just go off and list a ton. They're just in a unique position as they are targeted for sexual identity and gender identity. A lot of people feel like either like if they're like homosexual, like they may not be a man or like a good woman because of their gender attraction, and that can usually cause a lot of like mental disturbance, even though that's not the case. Like they're perfectly valid, and it just makes it the targeting of identity makes it difficult to express and feel safe. and their own identity. Risk factors. So risk factors, a very common one, it's going to be STIs because, again, especially in the gay community, like HIV is just a big thing that crops up. And a lot of that can be helped with education and I'm saying condom use, but there's a better word for it. Contraception. And but the statistic right now is 1 in 6 gay people and bisexual men will be diagnosed with HIV in their lifetime. And this is also increased for STIs in other communities as well. Just the gay community tends to be the largest one, but lesbians and other also struggling with this because just how the transmission occurs, and usually transmission is just higher within men to just male to male than female to female. And ways to prevent this is sex education and contraception use, and that's why it's very important as nurses. Sometimes we have to tackle strange topics because sometimes, especially in my research, basically I came to the conclusion that parents don't really work on teaching contraception use as much as they used to, especially they leave the education to other people, such as older siblings, because they think that they're going to help them, and it's just an uncomfortable topic for even parents and the children, because a lot of times we learn sex education in a heteronormative sense, and so we think two men and we're thinking oh, contraception is for preventing babies, so you don't need that, when it's very useful for preventing STIs as a barrier, just really helps. And so it just is really important to be able to understand topics and be able to talk about them, even if it's not exactly from your lens of view. Population is a high risk for self-harm, just like our patient was before. 4 times more likely to make a plan and attempt suicide, than their peers, just 4 times more likely. And I mean, granted, it's hard to tackle suicide because everyone has their own reasons and it's all going to be very individual and niche. But just to show that the community has a 4 times, this leads them to be vulnerable, and we just need to be sometimes respectful or more accommodating for that. The increase of self-harm and suicide usually comes from a lack of support. I did my preceptor at the BHU, and I've learned that so many of the problems is just when people don't have a healthy support system. If you have if you have a support system, that's a great long way of getting you places. But if it's not a healthy support system, it's very hard to actually because you can have toxic behaviors around you, or just people that maybe fun to be around, but they're not actually there with you. And so when things get hard, you realize how alone you are, and just isolation can be found pretty easily. To mitigate these harms, of course, it's always a very similar answer. Education just always seems to be a great answer in almost every circumstance. And it's to be accepting. Empathy and respect are always going to get you farther. And I think even just as nurses, we're the most trusted profession in healthcare. And that's mostly because we deal with patients and we actually try to do our best to we're there to help. And empathy, compassion is one of the best ways to get people to feel they have the dignity, they have their rights, because a lot of times people can bulldoze them even when they're not trying to, but they can just kind of disregard them, put them to the side. And that's why we're advocates. Barriers are also very individualized, but some common barriers are just within the social and community setting. Bullying, risks for violence, for sexual encounters. I think the LGBTQ community has the most sexual abuse and rapes. I think gay men equal straight women is the statistic that I found, or they're very similar essentially in most studies. And that's because of many factors and vulnerabilities. When people are vulnerable, risk-taking behavior does increase, as well as just not exactly understanding the situations that you're in, and that can just lead to abuse. 17.8% of gay, lesbian, and bisexual students reported having non-consensual encounters instead of 5.4 of their heterosexual counterparts. And so it just shows there's just a big vulnerability there. In the BHU or ER, you're gonna see that, and rape kits are a big thing. Healthcare access, quality also affects this community. Many struggle with mental health, and getting the resources they need they require to access the healthcare to meet their needs is difficult. And this mostly just comes from sometimes where like we treat the symptoms but not the cause. And so what happens is like we treat them and it's like, great, you're on an antidepressant now. You're doing so much better here because it's a safe environment in the BHU. And then you send it back to a home and like then there's still abuse / the same factors were there, and then we wonder why they come back when we haven't fixed underlying issues, and that's just so common. Homelessness is huge, and violence associated with the mental health struggles. And root cause, the lack of health, like the health disparity, the lack of acceptance, prejudice, unfair treatment, and discrimination. It just leads to psychological damage, mental distress, isolation, and poor health outcomes, which is something we always want to combat. Many times, root issues are not addressed, which is just kind of what I've just been trying to nail in. Just bullying, abuse, and discrimination can occur, and if we are not aware of that, and sometimes that can even just be for like younger kids, because like sometimes like they may not exactly know what their sexuality is, but like you can like tell like sometimes like you look at bruising, you can look at like strange burns, and we're mandatory reporters. So if we suspect something's off, we're supposed to report it. That's just part of our job and part of our license too. And it's hard because like I've had to report things that like I thought were questionable, and but you know sometimes it turns out all right. Like they investigate and it's all right, and sometimes they turn out and it's like, well, like there was an issue, and many times people are treated, and but they're put back in a community where the damage occurred. And I think that's mostly it. And yeah, but thank you so much for like letting me come and just talk to you guys. Sorry to take up your time.
No, that was. And you guys had some handouts, Carly, if you want to.
Yeah, these are basically just resources that like that I found. It's just part of like my project to like essentially just help people. So if you ever know someone, like these can be helpful. I mean, of course, like they might already know, but just because they know like doesn't mean like they can't know more, right? Or sometimes it just is nice to have them on hand. But you know, if you're not going to use it though, recycling is always a great option.
There you go. There you go. Thank you so much, Chris. That was awesome.